Welcome, everyone, to the La+Jolla+Cosmetic podcast. I'm your hostess, Monique Ramsey. Today, I have a very special patient on the podcast. Her name is Amie, and she had surgery with Dr. Luke Swistun, and we're so honored that she is happy to come in and share her experience with you, kind of her motivations, how the surgery went, what surgery she had, and try to help people who are maybe thinking about having surgery as well, and what the experience was like. And so welcome, Amie.
Well, thank you very much. I'm happy to be here. First time doing this, so
Yeah, that's okay.
excited though.
We'll get started with an easy question. Tell us a little bit about yourself.
I'm originally from St. Louis, and I ended up out in California as a traveling nurse. So I do work in the ER. Been a nurse for 17 years now. That's what brought me to San Diego.
Yeah, well, you don't look like you've been doing anything for 17 years.
Oh,
other than like taking amazing care of yourself because you're gorgeous. Tell us a little bit about what was bothering you, and what were kind of the drivers that helped you decide, okay, this is something I want to do, and tell everybody about what procedure you ended up having.
I actually used to live in Orange County. And I decided to get my bachelor's back in 2014. And I think that's when I started to see, oh gosh, where is this back fat coming from? Because, school, work, trying to balance everything, trying to work out, trying to eat healthy. Yeah, right. It didn't work. And so as the years went on, a group of us went to Tulum about 2 Decembers ago, and someone took a picture of me sitting at the pool from behind. And I thought, oh, I'm not liking that at all. Where is my whole body? Being over 40 now, that back fat is so hard. It is so hard to get rid of.
It's mean. It really is like Mother Nature's mean trick. Like back fat. Why? Of all places.
Where is this coming from? So I hated the picture. And as much as I work out with Orange Theory, Pilates, hiking, I just could not get rid of it. So I needed help. I did have someone recommend somewhere in Orange County. I went and spoke with them. I wasn't feeling it at all. I felt like a number. What do you want? What do you want to do? Okay, we can do this. It was just so informal. I didn't like it. So I kept searching in San Diego, and La Jolla Cosmetics just kept popping up. Then I had a friend who used to work with a girl that worked at La Jolla Cosmetics, and she recommended Dr. Swistun.
Oh my gosh.
Yeah.
That's nice to have like the inside scoop there.
Yes. The medical field, we're big, but we know people,
Mm-hmm.
That's what brought me. And initially I went in for to get rid of the back fat. And when I was there, I realized, you know what? I need to go all around. Like let's just, I'm going in, let's do this. So then that's when I decided to do the 360. There was no pressure from him. It was me deciding, I think this is going to look great, because if you just fix the back, but then it's not equal, it's going to look a little silly.
Yeah, that's true. Well, if there's other problem areas, it certainly is a lot easier to address them all at the same time.
Exactly. And he's just so, I mean, not only super sweet, but he's very meticulous. He will discuss and talk through every single thing. I mean, he was just so specific. He was very much, hey, let's get you involved in this too. This is what I'm looking at. Are you on the same page? And he was just so awesome like that. So it really made me feel comfortable. And I thought, oh my gosh, I think this is the guy.
He really is special. And I think he is such an artist that translates, like when he's talking to you at the consultation about whatever it is. I mean, he's so passionate about it, and he is such an artist. And, and his first degree was in photography and visual arts. And you had a photo shoot with him, right? which I just can't wait to see all the pictures. I got one little preview last week. I was like, oh my gosh. And so it's super exciting. But, it's like the artist in him from different perspectives and like from the medical side, but also just, he's seeing you and your whole body, to your point of we don't see ourselves from the back very often,
No.
which is maybe a good thing. But, that the whole addressing the whole thing at one time and kind of how he does his sculpting. And he and I had a podcast last week and it's about his 3-position 360 lipo. And we talked about the differences. So everybody listening in the audience, check that out because that'll help you to understand what his technique is for 360 lipo and how it's different and very special. It's just a little more involved. And so I'll give you that as the preview. But, did he talk to you about that part of it in the consultation?
He did. He went through everything with the abdominal and the back and had even suggested the area right above the breast, kind of going into the axilla area. Um, you know, even tons of skinny people still have that little
The little
fat
pooch,
up
the
there.
little
Yeah, that we have. And so, we did that as well. And I was so thrilled to have all this removed and have a new look on life. The new me of in my
Yeah.
40s.
So
Oh, my old body back.
yeah. Now, being a nurse and, being in the medical field, were you nervous at all about the consultation or was that not really something that was part of it?
No, I wouldn't say. I mean, his humbleness and how he explained everything just had this warm comfort feeling that I was in good hands. That I honestly nervous. I mean, probably the night before, obviously, like,
Before the
holy
surgery?
crap, this is happening. I'm really doing this. But just super excited, more so. And then, of course, everybody at the office was so awesome and so positive, and it just makes you wanted to go in there and have this done with everybody who was on the team.
Yeah. Yeah. Well, it's probably a big difference between emergency medicine and what we get to do every day,
Oh
right?
my gosh.
So
Everybody's in a good mood.
I know, and we're happy, and it's fun. It's fun
Yes,
to
yes.
see. I mean, the gratification of when you see patients who are super happy and they've gotten to their goal of what they wanted to accomplish. It's a really cool feeling, and we all, we just love it, and we love to participate in that journey with each of the patients. So you had the liposuction, where the 360 lipo, 3-position 360 lipo. And so tell me all the areas you had. So you had the little pooches by the bra line, your
Yes.
back.
Yes, basically almost the entire back and the abdomen. So I remember the day going in going, "Can you just make those nice lines, those lateral lines on the abdomen?" And he gave me a smile and he's like, "I got you. Don't worry." I said, "Okay, let's do this."
And you also had Renuvion of your abdomen
Oh,
and
yes,
back.
yes,
And the
yes.
Renuvion
Yes.
is a tool that we can use. It helps tighten the skin
Mhm.
because, even, I mean, obviously you were not like overweight prior to surgery. So it wasn't like you had like 80-pound weight loss and the skin was super saggy, but liposuction, and depending on how great your skin quality is or not and your age, it can be a little bit getting that retraction, I guess, getting that snap back is something that's not always super predictable. And I think the Renuvion is a very cool tool to help shrink wrap a little bit,
No,
right?
I'm glad you mentioned that because yes, he definitely have recommended that, and I highly recommend that. Because not only, like you said, you're taking away the fat, but you're tightening everything up
Mhm.
with it, and that is such a key. And it's a very weird feeling, but
Is
it's
it? What did it feel like?
it's a very weird feeling of the tightness because it's there for
Yeah.
oh, months, 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 months,
Oh,
and you
really?
feel so good with the garment on, like, you just don't wanna take it off. But, not painful.
Yeah,
Just,
but like tight.
whoa, this is
Like a
is
corset
tight.
almost, maybe?
Yes, it feels like a
Okay.
corset on your skin.
Oh my gosh, how interesting.
It's very interesting, and, you have that numbness for months, and so, yeah, that's pretty wild. I still have that tightness on the upper abdomen
Oh.
and in the back, but now I'm kinda used to it that I hope it doesn't go away because it feels so good now.
It's like a little hug.
Yeah.
You remember us. That's one of those, like, what do they call it? Like a, parting gift?
Yeah.
Here's your parting gift for participating in the getting ready for surgery and that kind of preoperative, you come in a couple weeks before, you have your
Uh-huh.
pre-op, and then in that time period, if it's a week, 2 weeks, usually it's about 2 weeks, then did you have any, I don't know, what were you doing to, I guess, plan for the surgery, like getting
Oh,
ready? As a nurse,
yes.
I would assume you're a planner and thinking about post-op in a way that maybe most people don't.
I also had a lot of help with all my nursing doctor friends. Girlfriend of mine who actually works in plastic surgery also up in LA, she is my lifesaver. All of them are my lifesavers that have come and helped me. And I prepped with, I'm trying to think, because I do work in the ER and there's a lot of nasty infections that go around.
Mm.
So we did like a lot of precautions with some ointment that I used under my nose. Just a lot of preventative to prevent any sort of infection. Vitamins. I made sure I stocked up on really healthy foods, high protein for healing well. I made sure I did all my extra like certifications early for work. Redid a bunch of stuff, get recertified and everything. So when I came back to work, I had nothing pending.
Oh, got it.
Oh, yeah. But yeah, I pretty much had everybody lined up. I gathered, my family doesn't live here. So all my girlfriends that I had here, I said, okay, I live by myself. We have to have somebody here. I need a
Yes.
friend a day.
Yeah. Right.
So
A friend a day. That's all it
I
takes.
I had a friend a day, and everybody was in line. Everybody was so excited for me, and they were on board. They were like, "Okay, I can do this day." And then somebody else was like, "I can do this day. I can do later
Oh.
in this day." And my one girlfriend stayed down for, I think, about 3 or 4 days, the initial. And being that she was, worked in medical spa, she had everything set up for me. She said, "Okay, we got your towels. We have your chucks because you're gonna
Mhm.
have drainage. We don't wanna get anything dirty. I'm gonna bring you a female urinal for when you pee because 'cause you're gonna dribble," and, like, things that you don't things
Oh,
that you don't
didn't even know that was a thing, but
think
I'm
of.
fascinated.
Yeah, so we had a female urinal.
Okay.
I prepped. Okay, don't laugh, everyone, but here's a question, right? Here's a question: how do I wipe my backside?
Oh, good point. Okay, and you've got a garment on, right? And you
I, right?
can't really move super well, I'm assuming, based on all the areas that he took care of. Y
Yes. So exactly. How do I wipe myself? So I got a bidet.
oh, well, you know what? That's becoming a whole thing. I know it's been a whole thing in other parts of the world, but, like,
Yeah.
lately, I see them all over the place. I saw one on
Yes.
Instagram the other day, like a little you can retrofit your toilet, which is
Yes.
actually genius.
I know. So my neighbor had one, and I said, "This is genius. I need this. This is so amazing." He's like, "I never saw anybody so excited for a bidet." I said, I don't know what I have coming, but I think this is gonna be a good thing." So I made him install it for me, and, yeah, so I had a bidet. It's so silly, but I washed my hair, made sure I washed my hair because I knew I was not gonna wash my hair for a very long time. Actually, 3
Yeah.
weeks.
Oh my
I
gosh.
I I actually went to a salon and said, "Can someone wash my hair?" I can't
Yeah.
raise my arms very high.
Yeah, it's just too hard.
It's too hard.
And you have such long, gorgeous
Yeah. Oh,
hair
thank
that
you.
it's like that's a whole thing. Let
It
them
is
do it.
because you feel so good after even your hair is washed, right? So
Yeah,
all these
that's
little
true.
things. But the garment, the one I had an opening to urinate and to defecate. And then, then that bidet came in super handy. I had girlfriends come over and they brought like a daily wipe. So because I couldn't shower for about 3 weeks with the 2 drains in. So I just did body washes that they helped me, areas I couldn't reach.
Yeah. Oh, that's nice.
I
Those are
know
good friends.
they're such good friends, and I think with
I think
all of us being in the medical field, we're like, well, we just have to get it done. Like,
yeah.
we don't care you're naked. You know,
Yeah.
this is every day with us.
That's so nice, though. I think good friends, that's when they show up for you. That's
Absolutely.
important.
So you need support though, because you need help. I needed help rolling out of bed because you don't realize how much you're using your abdomen. Can't lay around. You don't want to get, any complications such as, a DVT known as blood clots. So,
you have to keep moving, right?
Yeah, I would get up and I would just start pacing in the living room and just chit-chatting with my friends. Okay, I did my exercise for the day. But you can't really bend over a whole lot. So my girlfriends had to rearrange my fridge so I could get stuff or I couldn't reach stuff. So one of my girlfriends, genius, she did the grab. Have you ever seen that? It's like a pole that has like a little grab.
Yeah, like a little grabber. Yeah.
Yes. I was using that and it was fabulous. You don't realize all these little things. And
I love
I know these
Amy's
ideas are
tips.
great.
Amy's post-op tips. Her pre-op and post-op secret shopping list.
The female urinal.
Yeah.
And what else do we do? Oh, my robe, the tie on your robe. We actually tied it onto my couch and it helped me pull myself up if someone wasn't there. Because I live by myself. Remember that. I live by myself. So sometimes if somebody wasn't there, I had to figure out, okay, how am I going to shimmy my way off this couch?
So did you like tie it around the leg of the
Yeah,
foot of the couch or
the bottom of
at
the couch?
bottom? So then you can
And I just
kind of
help shimmy my stuff.
Man,
so we got really creative.
if you and I ever go on like Survivor or what's the one where the Amazing Race, I'm taking you with me, man. You're very
I can't take all the credit,
Amie MacGyver.
I definitely can't take all the credit. They all came up with different things as well. So
that's fun, though. That's fun.
So
you're gonna remember this, right?
It was so fun. Oh my gosh. Yeah, it was a good time. I would even once I start to go out and about, I would carry a big bag and have my urinal with me, which was great. My friends were like, what is this? I said, I had to get out of the house. I had to get out.
Yeah, have a little bag. Have bags will travel. Thinking about your mental guess, like prior to surgery, of like how much pain you might be in.
Oh, good question.
And what it really was. How much was it? Way worse than you thought? About the same? Way easier?
So, everybody has a different threshold for pain. My threshold is very, very high. I can handle pain, but surprisingly, it wasn't painful. I thought I felt as I did 1,000 crunches or I did some major back workout. I mean, I was so sore. I was so sore. I felt stiff, but to say like extreme pain, no. I took a gram of Tylenol and that settled my pain. Now, granted, he did give me some stronger things, but I'm also very sensitive to medication where it doesn't take a lot because I don't really take a whole lot of medications. So the gram of Tylenol for me personally worked fine. But however, when it wore off, I needed some more. So I had 2 drains. And I would say those were pretty sensitive. Again, just sore, but the Tylenol worked with that. But I would say that was probably the most pain was the 2 drains. They were just more, pretty annoying.
They're annoying, yeah.
Just annoying.
And
when they get pulled out, yes.
Yeah.
They stayed in for 3 weeks. We did have to watch. And so I had 2, right? So the first one was in the lower left pelvic area. The second one was in the lower sacrum area.
Oh, okay. Great. So then you can't really get away from where they are,
can't
right?
Get comfortable, right? We drained the JP drains. They were draining great, but we were watching them. I want to say, what was it? 1.5, close to 2 weeks, the front one came out. And I should have definitely have taken Tylenol before that because kind of threw me off a little bit. Kind of like
it's a shock.
It was very uncomfortable. Let's just say
it's
that.
a weird feeling. It's a weird feeling, and but I mean, it kind of is quick, but at the
It's
same
very
time,
quick.
it's weird. It's
And
just
I
weird.
I should have taken Tylenol. I did not. But in fact, that I kind of had a little vasovagal reaction. To it, where I was like, "Ooh, I'm seeing spots. I think I need to sit." But honestly, that happens to a lot of people. That's not uncommon. So I just sat down. They brought me some juice. I was fine. 15, 20 minutes later. But it is super important though to have someone there the first time you shower because you think you're drinking enough fluids. I did have a bit of a near syncope, I guess you would say, episode in the shower. And I had a girlfriend there and I was like, oh, I got to get out. I got to get out. I think the shower was too hot. I need to get out. I'm seeing spots. But
so where you just felt like super lightheaded, like you might go down.
Yes. Yeah. So I need to get out and lay down. Let's elevate my legs. I'll be fine. And it passed. So, and he does talk about, hey, make sure someone's there with you before, because this is something kind of common, not scary. It's not dangerous. It's just, you just listen to your body.
So in terms of the team around Dr. Swistun, kind of who was the team around you and where did they come in? Was there anybody kind of who made that experience you had easier?
So Kayla, who works with Dr. Swistun, she was there. She was awesome. She coordinated everything. She's very organized, right on top of everything. So I never really had to ask twice with anything. I mean, she just had everything put together. And then Nancy was awesome. Oh, you know what? So she went over, there's a book that they give you, this packet, and she went over the packet and what I needed to do, the expectations, what to expect, what to mentally expect during the process. So with that packet that Nancy went over, that was really awesome. Ruth in the OR, she was great.
She's the best, isn't she?
She's awesome. She used to be an ER nurse as well, so it was great, kind of reminiscing like with her, as an ER nurse to an ER nurse.
Mm-hmm.
The anesthesiologist, he was so nice. He was kind of funny because obviously I have these eyelashes, and he goes, "Oh man, I'm so sorry. We might have to." We're going to have to shut your eyes with tape. They might come off. I said, oh, no problem. These are old. Don't worry about it. I thought, that's so sweet. Like, he was worried about my eyelashes. I was like, who cares? I can get those.
I'm not going to be seeing anybody anyway for a while.
I'm not going to be seeing anybody for a while. So,
oh, that's cute. That's cute. And so how long? So you had a drain in. You said one of them was there for 3 weeks. So I'm assuming you weren't back to work for at least 3 weeks, and tell us a little bit about getting that, like how much time did you allot to take off? And then did you have to extend that, or did that turn out to be right? And how was getting back into work? Because I'm sure in the ER, I can't even imagine you ever get to sit down ever.
Yes. So we planned for 6 weeks.
Okay.
Just because the job is so physical. At 6 weeks, I still was having a bit of a difficult time still getting off the bed, or off the couch. And I thought, oh, how am I going to take care of patients? I can't do this. So I actually did, well, here's something I haven't talked about either. We did lymphatic massages, which is super important. Because you want to keep everything smooth. You don't want anything to get hard. And so Kathleen is amazing, that they recommended. I asked to go to her a couple more times, or, called her up. And because it loosens it up, it really makes you feel good.
She is so good. She's one of my favorite people. I love her. And
amazing.
She's such an expert at it. I mean, she teaches people all around the world how to do it. And she knows, and for plastic surgery patients specifically, she knows, and you can feel safe with her because you know she's not going to do anything to hurt you. And because there's people out there saying, oh yeah, I'm a lymphatic massage nurse or specialist, and they might have taken a weekend course and they don't really know like what's safe, what isn't. And, this is surgery. And so, but doesn't it make you just feel It's the weirdest thing because it's such a light, it's not like a massage, and just moving the fluid. But like, I remember after having mine, my whole body felt like everything felt better. My mental capacity was better. Like everything felt so much better. Just moving that swelling. I had mine after a
Yes.
facelift, and
Okay.
I had gotten a little hematoma, of course, because I was throwing up because I was sick,
Oh,
and
no.
all the things that happen to
Yeah.
you. But I was really puffy. I looked like a pumpkin, I thought. And I had to go to a wedding like in 10 days from the beginning of the facelift. So I was like, I gotta do something. But I just didn't feel that good either. And it was like, not only did it clear up the issue and help, take the swelling way down, but I
Yeah.
felt better. And it was like, I don't know what it's doing in there, but this is the best thing ever. Moving the toxins out or something.
It was great. Yes. So that is also a big part of healing because it decreases the inflammation. It keeps everything smooth. It's so incredible because it like you feel like you're shrinking because the garment fits better afterwards, like everything. So I did a few more things, a few more lymphatic massages, to really get me ready, because we did have to extend it 2 weeks.
You brought up compression garments. So how long did you wear them, and how many times did you have to keep getting smaller ones?
Oh my gosh, and it was very exciting. So originally they gave me a garment that I wore, and then the next round, I think was a medium, and then we went to a small, and then I had to order an extra small garment, and I wore that. Oh my gosh, I have to say, like months.
Because it feels good, right? This is what
It
I keep
feels,
hearing from
it
people is that it
yes.
feels better on in a way than
Yes.
off.
Yes, because you feel the, like I said, that tightness feeling, and so
Mhm.
when it comes off, you feel like, "Oh, I need to get
Too jiggly.
I need to have that support again. I need to have that
Mhm.
support," even though there's nothing wrong, but you just feel so good with that support of the garment.
Okay, so tell me about getting through the summer with this, because sometimes people think, "I don't know if I wanna be all summer in a garment. Like, am I gonna be too hot? Am I gonna be," or whatever. More revealing clothes might be hard for now, was the garment like, how long did it go on your thigh? Was it, like, short? Kind of,
Oh, the
'cause
garment,
or
it
was it
pretty
only to your pelvic area up to your armpits?
oh, yeah, no, it was under the breast and, kinda like underwear. Yeah, so I thought it was comfortable, it wasn't hot at all and, or uncomfortable, but honestly, during the summer, it was easy because I could throw on a quick little sundress
Yeah, it's almost like a
over
slip,
it.
right? Yeah, yeah.
Yes, yes. So I think it was easy because you have easy clothes to wear during the summer. So in that aspect, I thought it was really, really easy. But I'm also a summer girl, so I thought, "Oh, man, not yet. I can't go in my swimsuit and show this off."
Okay, so when did you feel like, did you have a moment of like where you were wearing something, either a bathing suit or a special dress or a certain occasion where you were like, wow, this,
Yes.
because your whole lifestyle is kind of upended, right? Between
Yes.
work and all your friends coming and like everything's completely kind of thrown out of joint. And so where was it where you had that moment of like, okay, this was
Oh,
really a good idea?
yeah, so I absolutely remember. It was Labor Day weekend, one of my best friends came down from Orange County, and it was the first time that he had saw me, and, I had my swimsuit on, and he was like, "Oh my gosh." He's like, "You look like Barbie," and, I go, "I feel like Barbie," and so we took a picture, and actually I sent it to Kayla, and I go, "Look, I feel like Barbie. Thank you so much for making me look like Barbie." And yeah, that was probably the first moment that,
That's so cool.
yeah.
Now tell me about, where are your scars?
Well, he was loving it because I have tattoos. So
Oh,
he's So he's like,
Oh,
this
this is
is
easy.
great. I can hide them in your tattoos. And he did. I can't see any of them. There was one in the lower right pelvis that you can't see. And then there was two in the lower back that was through my tattoos. So
Oh,
I
perfect.
can't see anything.
And you didn't have did you have any incisions for the little
Oh,
pooches by the bra line at
oh,
all?
yes, yes, yes. So
I'm
he,
like, how did he get
in
up
the
there?
axilla, yeah. So he went through the areola. I woke up and I was like, whoa, steri strips. Okay, that's where he went. And then yes, under the axilla, there was two little incisions there.
So tell me what you would tell somebody who's thinking about a 360 lipo or, really any kind of, from a body contouring. I mean, you've been through it. What would you tell them about the process?
Well, I'd first of all, I'd be so excited for them because if that's something that you're looking to do, I'd say do it because whatever makes you happy, whatever that is in your life, because being a nurse, when we see some not so glamorous things in the ER, that I always tell people, you have one life to live. Live it, enjoy it to your best.
And what would you tell someone who's looking for a plastic surgeon?
Well, medically, I'd probably look into, what's their infection rate and then look at their results of others. Once I got in there, I would see, how are they treating me coming in? Like before, am I a number or do they actually care that I'm going to come here, that I'm not a number, that I'm a person and they're trying to make a difference in my life. And also a plastic surgeon who would listen to you, not just, okay, I hear what you're saying. I can do that for you. Are we good? Somebody that gets you involved with your decisions and make sure that they're on the same page. Exactly what Dr. Swistun did. That he legitimately he cares. He
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 does.
he wants the best for you, and the best outcome. And somebody that makes you comfortable. Somebody's
Mhm.
that's not rushing you. Somebody that's again, seeing what you're seeing and you're on the same page as well.
So any other last words of wisdom you have, Amie, because you have so many good, like we've gotten so many tips out of out of this
Oh, good.
session. It's so good. And
Good.
and we're gonna put in the show notes some pictures from your
Oh, great.
amazing photo shoot. Oh, you guys.
Yeah.
I can't wait to see them. Dr. Swiston, he's like, yeah, well, I've gotten through editing like lighting and whatever,
Yeah.
cropping, through editing like 1,000 of them, and I have like
Yeah.
another I'm like 2,000 photos. He goes, "Oh yeah, that's like a normal photo shoot." I was like, "Oh my gosh." It's so funny. So, I'm sure you have like Christmas card material galore from this. Or for your Instagram, you can have a whole profile just dedicated to so what kinds of things did you wear? Because I only saw one photo, so I don't know.
Oh, okay. So I wore my swimsuit. I had an outfit that I brought that I wore for New Year's. It was a two-piece outfit, a dress and a top. And then I wore another dress that the whole back was open
Oh,
to
neat.
show the back. Yeah.
Very nice, because
So
that's where we started. It's full circle. We started with the
yep,
back fat, and
yep,
then you should get to show off, with a backless dress. I don't think I've
yeah.
ever it's been 30 years since I could have worn a backless dress. So
I
I think that's awesome. That's so
I
nice.
was excited. Actually, a friend of mine, that was my Christmas gift from her. She's like, "You deserve this
Oh.
dress. I saw this." So grateful. So that was the one that I wore for the backless.
I love
Yeah.
that. All right. Well, any other words of wisdom, or we're going to just like let you enjoy your amazing life, Amie, the nurse, and hope that we never see you in the ER, right? That's what we
Yes.
all want. We don't want to meet
Right.
her in her job. We'll just have you come back and give us more tips each year. Maybe we'll have, expert Amie
Oh
and
my
her
gosh.
MacGyver tips for surgery.
I love it. There was not that I never had confidence because I know I had spoke and said I wanted my old body back, what I was in my 20s, which I didn't have any that I felt that I was not happy about. after the age of 40. And I do want to say that it is such a confidence boost, and just so powerful when you have that confidence and you just feel so good about yourself. And I had one of my friends who I met when I went back to get my bachelor's, when she came down and saw the results and just my whole aura about myself, she goes, I love you to death and you're back because your energy, what you had when I met you, um, it's it's back. It's where it was when I met you. And it's just so happy to see. So
Oh,
it
that's
was,
so
yeah, it
nice.
was really
Wow.
nice. And I said, yeah, it's amazing. I feel so good. And the other thing though is, I have not given up working out. I mean, I work out hard. I actually was at Orange Theory right before I came here. Every day I have off of work, I'm doing Orange Theory, or I'm lifting weights, I'm going on a hike, I play tennis. I'm still very, very active, which is super important because he did the hard part, right? The surgery. But you also need to know that you have to maintain it.
That's a really important point. And one of the patients who came and was in our photo shoot, he was talking about how his surgery, and he had lipo of the abdomen, and how his surgery like really kick-started
Mhm.
his healthy lifestyle. And it was 3 years later, and he's like, "I've never been healthier. I eat great. I exercise." And he wasn't super overweight, but he just was like, there was a little extra. And
Yeah.
he got rid of it, and he said, "I'm so motivated because,
Yes.
to keep what I have." Well, it was fun to talk to you, and I can't wait to
Ah,
see all these photos from Dr. Swistun of
yeah, same.
your beautiful
Thank you.
three-position, 360 lipo. So, Amie, thank you again. And for everybody in the audience, whether you're watching us on YouTube or whether you're listening on one of your favorite podcast platforms, subscribe. Every Tuesday, we have a new episode. And, if you have any questions, like throw them in the comments and we'll get them answered for you. And we'll have links in the show notes to all the things we talked about, because we talked about so many. Producer Hannah, she'll have her work cut out for her to get us all those links. So thanks, everybody. And we'll
Awesome.
see you on the next one.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.